Good afternoon, everyone. Welcome to the TA Marketplace vendor webinar. We're going to be presenting vendors that were approved in rounds 4 and 5 procurements. As far as introductions go, on behalf of DHCS, we have Michael Weezer, who is the Chief of the Managed Care Program Oversight Branch. Myself, Lisa Bistra, I am the Chief of the Providing Access and Transforming Health Unit. Jill Clayton, she is the Chief of the Project Coordination Section. On the Public Consulting Group side, we have Trish Garzelli, she's the TA Marketplace Advisor, Jenna Wall, TA Marketplace Lead, and Courtney Schaefer, TA Marketplace Team Member. I am going to go ahead and pass y'all over to Jenna for the rest.
Great, thanks, Lisa. Well, welcome everyone to another TA vendor fair. For those of you that joined us last spring, you may recall that we had these 5 or more great vendor fairs, and we wanted to extend the opportunity for our vendors that were approved over the past year to showcase their services to you all and how they can support you on the TA marketplace. So I'm going to be giving a brief orientation to the TA vendor fairs. Then the vendors will provide a pitch slide and showcase their services. We'll move into breakout rooms after that, and then have a quick update on TAM and open for Q&A. We can go to the next slide. So again, the purpose for today is for an opportunity for vendors to share information about their organization and services to support potential TA recipients on the marketplace. And this vendor fair is featuring vendors that were approved over the past year during our rounds 4 and 5 procurements. Next slide. Just a quick overview, particularly as this will support our breakout rooms. We do have the TA marketplace broken up into 7 domains that really represent a lot of different areas in which our vendors are qualified to offer services. They range from building data capacity to supporting contracting to training workforce. We also have some newly added areas of focus that have vendors that were approved in, having experience serving different provider types. And those folks are represented here on today's call, but also vendors from previous rounds. And we encourage you to visit the marketplace to identify a vendor that may have experience in one of those areas of focus. Next slide. So our high-level agenda for today, we're doing the welcome and intro. We're going to move to those vendor pitches. So each vendor will have about 60 seconds to present their pitch. We are joined by, I think, about 35 vendors today, so a really large group of experienced organizations to support you on the marketplace. We will then move to breakout sessions, which are really an opportunity for recipients and attendees of today's call to ask specific questions of the vendors and get a little bit more information about the services they offer. We'll then have our Q&A and reminders and conclude today's event. Next slide. Just a little bit of logistics before we really get started. The first is that please ensure that you have the Zoom application downloaded to whatever device you are using to join today's event. The Zoom application must be used in order to access the breakout rooms that, again, will be a key feature of today's webinar following the vendor pitch slides. So again, that Zoom app is really essential to be able to get a full picture of the vendor services and participate in those sessions. Additionally, you will see at the bottom of your screen a Q&A feature. Please use the Q&A feature to ask any questions. However, we do have a request Please use this functionality for general questions regarding the TA marketplace, and we will answer those questions towards the end of today's event. Or if you are experiencing any technical issues, you can also use the functionality to have a member of our team support you there. Again, the breakout rooms are really meant for those vendor-specific questions, so we do request that you hold those questions for vendors for the breakout rooms. Next slide. Okay, with that, we actually got through a little bit quicker than I anticipated, which is great news. So we will be moving to our vendor pitches. Next slide. All right, so just a really quick overview of what is going to be happening here. We have, again, 35 vendors on today's call, one person representing each organization. Vendors will be presenting in alphabetical order by organization name. They will have 1 minute to present what is on their side and showcase their services on the marketplace. And again, a reminder, please don't use the Q&A feature to ask those vendor-specific questions. Using the breakout rooms will really be that opportunity to follow up with specific vendors about any questions that you may have that they describe in their pitch slides. Next slide. All right, and that keys up our first vendor, which is Anchor Group. So I will pass it to them for their presentation. Is Kevin on the call? If not, it looks like we will skip over them and move to the next vendor, which is Aspire Innovators. So will Lucy please come off mute and present?
Hello, good afternoon. Welcome. It's exciting to come and present information on how we can help your organization or your county or your nonprofit organization develop the concept of wanting to begin to utilize CalAIM as a way to sustain and improve services for our families. And so Aspire Innovators, we are a consulting team of many of us have retired from health and human services or from nonprofit world. And we actually have experienced CalAIM supervisors, program managers, administrators, evaluators, probation officers, focusing on JI, justice involved, evaluators, grant development. And we basically, our team is able to take you from the concept of wanting to start CalAIM services in your community to effectively billing and getting reimbursed. Our goal is to be able to help you in this journey and provide you a 360 one-stop CalAIM approach. We focus on domains 3, 6, and 7. As you know, obviously 3 is being able to help you engage in the CalAIM, Medi-Cal managed care. We also help facilitate the supporting cross-sector partnerships to help you not just internally, but also externally with your partners to be able to leverage resources and provide a continuum of services through CalAIM so that you are working together collectively to support clients instead of trying to figure out what's the best case, individually. Our goal is to
Lucy,
conversation.
sorry, Lucy.
Yes. And so for any questions, Aspire Innovators, please feel free to reach out.
Great, thank you so much.
Thank you.
We can go to the next slide, which is behavioral health outcomes data services. So Liz, if you can come off mute.
Thanks so much, Jenna. Hi, everyone, and good afternoon. CalAIM is raising the bar on accountability, and without robust data systems, too many organizations are left with less clarity, more surprises, and less ability to prove their impact. And here's the truth. If you don't understand your outcomes and impact yourself, you won't be able to explain them to funders, partners, or even your board. Hi, I'm Liz Harvey, and I represent Behavioral Health Outcomes Data Services, or BHOTS for short. We're an approved vendor in Domain 1, building data capacity. We offer both off-the-shelf products to establish a framework for the metrics that matter the most, and hands-on services tailored to each organization's business requirements, staffing models, and structures. When capacity is stretched, we can also augment your existing staff. Our goal is bigger than compliance. We aim to up-level the field so that organizations like yours are ready to thrive in a value-based environment with more clarity, fewer surprises, and stronger proof of impact to ensure long-term sustainability. Looking forward to having the discussion in our breakout group.
Great, thank you. The next slide, we have Blue Ridge.
Hello, everyone. Nice to meet you all. I'm Liz from Blue Ridge Management Solutions. Another Liz. Nice to meet you, Liz Harvey. We are a Sacramento-based team with the capacity to travel statewide. I'm excited to share that I have early CalAIM program implementation expertise dating back to 2022. Since then, as a consultant, I have helped over 20 organizations secure contracts with managed care plans across the state of California to provide CalAIM services. As a team, we have brought success to many organizations through our team of subject matter experts across the 5 domains that DHCS has approved Blue Ridge for. We are a designated technical assistance vendor specializing in CalAIM startup support and CalAIM program expansion. We help you every step of the way, whether you need policy development or contracting support. Our team is positive, hands-on, results-driven, and we are ready to roll up our sleeves for your organizational success. I look forward to meeting you and learning more about your organization in Breakout Room 3. Thank you.
Great, thank you so much. We can go now to California Quality Collaborative.
Good afternoon, everyone. I'm Carrie Donahue, and it's great to be here with everyone this afternoon. So the California Quality Collaborative, or CQC, is a California-based nonprofit dedicated to equipping care teams with expertise, infrastructure, and tools they need to deliver high-quality, equitable care. We have deep experience across the Medi-Cal system, supporting both primary care and behavioral health providers. Our current work centers supporting CalAIM providers across 2 different domains. So under Domain 5, Health Equity, we help providers identify disparities, engage patient voices, and implement strategies that address social drivers of health. And then under Domain 7, Workforce, we support training and infrastructure to strengthen and sustain the care team, helping providers build the skills and capacity they need to deliver whole person care. We've partnered extensively with maternal and child health providers, strengthening care delivery and outcomes for patients, infants, and children. Organizations work with us because we really prioritize equity and cultural responsiveness. We deliver practical, on-the-ground support that helps care teams better serve underserved and marginalized communities while building a sustainable workforce for the future. And I look forward to engaging with you all in the breakout rooms. Thank you.
Thank you. Next up, we have keynotes.
Hi, I'm Alex Arajanian. Good to see you, Carrie. They do a lot of good work over at the Collaborative. I lead Care Notes. I'm the CEO of Care Notes. And I come to you with a wealth of experience from the health plan side to the provider side of things, and really at the forefront of CalAIM implementation, working with HealthNet, Kaiser, LA Care, and a lot of the kind of regional plans, SanCal, and so on. And our strength, our expertise really lies in getting contracted. And not only just getting you the contract, because the contract could take you only so far, right? I could put $1 million here for CPT XYZ, but until you bill CPT XYZ and track that claim through the process, you're not guaranteed any type of payment. So not only is contracting important, but the implementation that comes from that contracting process is absolutely critical. And when you're choosing your vendor, so we don't just check boxes. We essentially partner with the provider to make sure that they're able to navigate this very, mainstream jargon part of the industry, which is managed care. And how do you make sure your first contract is a sustainable one moving forward? So I'll be in breakout room 3 with other vendors, and would love to have you in there for some intimate Q&A and see how we can help you, implement this massive legislation.
Thanks, Alex. All right, we can go to our next slide, which is Carmona Insights.
Hi, everybody. Really thankful to be here. My name is Cynthia Carmona. I'm the principal consultant and founder at Carmona Insights. We are a pretty small boutique firm here in Southern California, and we provide community health consulting services to mission-driven organizations like many of you. Myself and my few colleagues, we really come with a lot of experience really leading CalAIM implementation at multiple managed care plans, so super familiar with what the MCPs are looking for. I myself have really extensive FQHC experience. So if you're an FQHC out there, super experienced with policy and implementation there. My colleague Mary is a licensed clinical social worker, so she does a lot of training and technical assistance for your on-the-ground care managers. And we have another colleague who has a really extensive managed care operations and quality management experience as well. We've served, just in the few short years we've been around, over 80 provider organizations with their CalAIM implementation. And we provide a range of services in domains 1, 3, and 6 with a lot of extensive experience with maternal child health and rural providers. So thanks so much. Lots of respect for the work you all do, and really hope we get to work with you all in the future.
Thank you. Next up, we have the Center for Applied Research Solutions.
Hi, good afternoon. I'm Angela Castellanos. My pronouns are she, hers, ella, and I'm a managing director at the Center for Applied Research Solutions, or CARS. CARS is a California-based nonprofit with 30 years of impact, and some of our areas of focus are behavioral health, crisis response and recovery, student and staff and well-being, and community health and wellness. We're also a full-service training, consultation, and evaluation provider, and we lead many national and state projects that support the health and human services workforce. Our approach is really to provide responsive, high-quality services that are really customized to the needs of the TA recipients. And we work hard to build those positive and supportive relationships with the organizations that we serve. So we warmly welcome you to check us out at cars-rp.org. Thank you, and see you in room 5.
Great, thank you so much. We now have Children and Families Coalition of Orange County.
Thank you. Hello, I'm Erin from the Children and Families Coalition of Orange County. We are approved vendors in domains 3, 4, 5, and 7. At CFCOC, we help community-based organizations turn CalAIM's enhanced care management and community support requirements into real-world systems that work in practice and supported with documentation. What makes our TA unique is that it's deeply collaborative. We don't just bring our team's expertise, we also bring lessons learned from working alongside dozens of other CBOs navigating similar challenges. That means you get customized support and access to real strategies that are already working in the field. We focus heavily on building the foundation, workflows, trackers, and technical systems, all tailored to your team, your capacity, and your community. And we make sure everything we do is sustainable beyond the TA funding period. Our questions for you are, what do you need and how can we support you?
Thank you so much. All right, we'll go to Clutch.
Hey everyone, how's it going? My name is Johnny Perez and I'm with Clutch. And we are an award-winning certified women-owned government consulting firm located in Sacramento. We've had some really great success doing all the COVID work for California Department of Health, managing teams of over 200. Also doing a lot of work in the Healthcare Access Information in California, HCI, doing policy and program work along with health equity, which got us into the CalAIM area. So we are an approved CalAIM vendor in domains 1, 6, and 7. And our goal is to focus on supporting clients, experiencing great change and growth, and apply a strategic and supportive mindset to everything we do. We have a lot of history working with HHS, workforce and education, and emergency management and response and recovery. A lot of our really 3 main areas of focus are digital innovation, policy program implementation, and community engagement. Looking forward to working with all of you and seeing how we can expand our services to everyone.
Thank you so much. Next up, we have Collective Impact Solutions.
Hello, everyone. I'm Dr. Rebecca Salas-Mendiola, CEO of Collective Impact Solutions. CIS brings over 25 years of experience leading systems change, systems transformation across education, behavioral health, and community wellness. We help schools, community organizations, and public agencies build sustainable cross-sector systems rooted in health equity. We've designed proven schools, city, county-wide, and systems of care with clear tiers, pathways, and protocols, strengthening existing networks while aligning with CalAIM, Medi-Cal billing, and equity goals. Through the TA Marketplace, we support enhanced care management and community supports by building unified no wrong door infrastructure, supporting provider readiness, creating referral pathways, and embedding CalAIM into systems change frameworks. In short, CIS helps partners reduce barriers, sustain funding, and deliver integrated services that drive real community impact. We will be in breakout room 6, and I look forward to connecting with you.
Thank you so much. Next up, we have community. And let's see, just making sure, not hearing anything. Last call. And I don't see their representative on the call today. So we will move on to our next vendor, which is community-driven strategies.
Good afternoon, everybody. My name is Claudia Ramirez Flores, and I represent Community-Driven Strategies. I'm really excited to be here with you all today. Community-Driven Strategies supports counties, tribal health providers, and community-based organizations across California in implementing CalAIM, ECM, and community supports. Our team has built programs in San Diego, Imperials, San Bernardino, San Francisco, Riverside, Kern, Tulare, Fresno, Sutter, Yuba, Placer, Trinity, all throughout California in different counties. Our team blends policy expertise with real world practice. In our team, we have a former First Five director, county administrators, alcohol and drug program administrators, behavioral health managers, an awesome tribal chair, and frontline case managers and clinicians. So it really gives us the hands-on practice that we need. With deep experience in rural and underserved communities, we help organizations design sustainable programs that meet compliance and truly reach populations of focus. We have subject matter expertise in recuperative care, sobering centers, short-term post-hospitalization, rehabilitation, housing bundle, the JI initiative, and ECM and community supports. I really look forward to connecting with you all in the breakout rooms. Thank you.
Great, thank you. We now have Compass Health Advisors.
Good afternoon. I'm David Kim, CEO of Compass Health Advisors. At Compass, we partner with health plans, providers, and community-based organizations nationally and throughout the state of California to advance whole person care for the underserved and safety net populations. Our core focus is on leveraging people, process, technology, and data to achieve the quintuple aim, which is better outcomes, lower costs, improved experiences, and greater equity. We know that for TA marketplace recipients who are delivering ECM and community supports, one of the toughest challenges is related to how your IT infrastructure enables these programs. As a vendor focused on Domain One, we not only have a deep understanding of the components of your IT portfolio, but more importantly, we understand ECM and community sports program requirements and workflows, and that should be the starting point for program optimization rather than the technology, and certainly not the other way around. So our technical assistance is both data-driven and practical. We understand the barriers faced by marginalized populations and work side by side with you to design solutions that are actionable today and sustainable for tomorrow. So thank you for your time, and I look forward to diving deeper as part of Breakout Room 8.
Great, thank you so much. Up next, we have Connected Care. If we can go to the next slide. All right.
Good afternoon, everyone. Welcome to Connected Care. My name is Dr. Eric Rosen, and Connected Care brings together not just a group of subject matter experts about CalAIM, but actual healthcare professionals that are here to transform your organization into a viable solution for people that are struggling in your communities. Connected Care has an extensive amount of expertise, including implementing transitional rent. We've already been tagged by a series of Medi-Cal managed care plans to provide information about how to best build out this new benefit. Our services can include for you certification and contracting, creating workflows and policies, procedures, all the forms and stuff you got to have in the background, a true revenue cycle management process where you can transition from sited to a viable revenue source, identifying and securing third-party funding sources through counties, cities, COCs, and so on. Cited doesn't have to be the end of your organization's funding for CalAIM. It is just the beginning, and Connected Care is in a good position to help you get there. Reach out to us and look forward to seeing Breakout Room 6.
Great, thank you so much. Up next, we have Culture Ally.
Hi, I'm Dr. Shawan Worsley, Principal Consultant at Culture Ally, and we are a boutique training and consulting firm that partners with healthcare organizations, nonprofits, and public agencies to build equity, resilience, and workforce excellence. We're really a people-first organization. We're known for our high-touch partnerships where we listen closely, customize solutions, and consistently deliver results with high satisfaction. Through the marketplace, we focus on 2 domains, health equity and workforce development. We help organizations strengthen inclusive HR practices, conduct equity audits, and provide equity and inclusion training. We also build stronger teams through leadership development, customized onboarding, and executive coaching. We're certified by the American Psychological Association to provide continuing education, so our trainings give staff CE credits while building real-world skills. Our clients really tell us that our work makes their teams more resilient, connected, and better prepared to serve their communities. So if this resonates, I would love to speak with you more in Breakout Room 7 and explore how we can support you and your team.
Thank you so much. Up next, we have Dreamcatchers Performance.
Hi, everyone. This is EJ. I'm the Chief Strategy Officer of Dreamcatchers Performance, and congratulations on being approved as a CalAIM provider. I can only imagine what this journey has been to get to this point. And so many of you started doing this work because of personal experience and wanting to do something about the pain that you were seeing around you. But here's the reality that we hear every week. You're doing incredible work in your communities, but you're owed $500,000 to millions of dollars for services you've already delivered, right? So meeting community needs does not guarantee that you're going to survive as an organization. Let that sink in. So many of you are struggling to make payroll every month. You're struggling to keep the lights on. Your staff is overstretched. Your supervisors are firefighting, constantly being pulled into work that your frontline teams are supposed to be managing. So at Dreamcatchers Performance, we focus on 2 critical things. Number 1, aligning your workforce with services that will pay you the most from the health plans. And number 2, equipping your supervisors to actually lead rather than firefight. If this aligns with your priorities right now, join me in the breakout room number 7. Thanks.
Great, thank you so much. We now have Focus Strategies.
Hi all, good afternoon. My name is Diego de la Pesa and I'm with Focus Strategies. We are a national consulting firm dedicated to helping communities improve their homelessness response system and house people as quickly and equitably as possible. And we support organizations to leverage data and analytics to identify strategic opportunities to improve their systems and services. We have extensive experience in the intersection of CalAIM and homelessness services and are an approved vendor for the domains of building data capacity, community supports, promoting health equity, and supporting cross-sector partnerships. Some of our prior relevant experience includes leveraging the Homelessness Management Information System to collect CalAIM services and billing data, using managed care provider data to target services in homelessness response system, designing community support program models that align with homelessness response system, and developing strategies to target ECM and community supports to address disparities within homelessness. We will be in breakout group 1 and look forward to learning more about your organizations and how we can support you.
Thank you so much. We now have GEIS Collaborative.
Hello, everyone. Welcome to GEIS Collaborative. We are a women-owned consultancy helping organizations to design, build, scale, and then optimize critical social healthcare programs like CalAIM. We have been where our clients are now, leading organizations, running operations, managing the budgets, and still delivering results every day. Our managing partners bring over 25 years of executive and board experience, as well as 12 years in strategic consulting. We offer 15 off-the-shelf projects and hands-on support across domains 2 to 6. Our most popular projects include a CalAIM organizational readiness assessment, our much-loved 3-year budget and financial modeling project, ECM and CS design and implementation to help you launch CalAIM, ECM and CS optimization for those who have launched and now want support to improve, and cross-sector partnerships to develop strategic referral sources. Clients value our deep expertise in MCP contracting, financial modeling, and CalAIM design and implementation. We bring both strategic insight and hands-on execution to make CalAIM ultimately easier for you to manage, more successful. I look forward to sharing more information in breakout room 2. Please feel free to reach out if you have any questions. Thank you for your time.
Thank you so much. We now have health communication partners.
Hi, everyone. I'm Dr. Anne-Marie Liebel for Health Communication Partners. It is a delight to be here today, and I'm really enjoying hearing about everybody's stories and everybody's offerings, and it means a lot to be part of this group today. We are a specialized communication firm, work across government, healthcare, industry, and academia, and we help organizations build communications and partnerships to advance health equity. Our core work includes supporting cross-sector collaborations, building communications capacity, advancing continuous quality improvement, and strengthening health literacy. And all of this is through an equity lens and grounded in research. I think what sets us apart is that we don't just consult, we co-create, and we help organizations build lasting capacity. Our clients say we offer something rare, and you can get some free exclusive resources for our hit podcast series, 10 Minutes to Better Patient Communication, where you get your podcasts and a QR code there. We'd love to connect on LinkedIn and in breakout room 6 and hear about your work.
Thank you. Up next, we have Health Policy Matters. And if you're talking, you're on mute. I know you were on at the start. Meryl, are you still with us?
I thought you unmuted me. I'm Meryl Price. I'm the president of Health Policy Matters, and I lead a team of 5 people with between 30 and 35 years experience each in care management design with a high focus on integrated care, a behavioral health expert, a practicing clinician who's now actually an owner of an F2HC, who's worked in F2HCs and health plans for her entire career, a data scientist, and then people who just generally are health policy experts that help put together the work in a cost-effective manner. When you hire Health Policy Matters, our arrangements have been such that we've completed, I think, 11 or 12 CalAIM engagements, but we work all over the country, not just in California. So we bring you the advantage of knowing best practices and what the landscape looks like all over, but we also know CalAIM pretty thoroughly. The way that we work is that we offer the opportunity to have us build your application and make this a really painless process for you where, with all due respect to those who are running this, it could be a painful process, and especially now as the money is dwindling. I would say that our main focus is on care management design and integration. We're in breakout room 3, and we also work with Innovation Horizons, who covers all of the domains, and I hope I'll hear back from some of you. Thank you.
Thank you. Thank you. Up next, we have Hess Consulting.
Hey everyone, thank you for allowing me to be here. My name is Chris Hess, and we're an approved vendor in workforce training for de-escalation skills and conflict response. We know every day our CalAIM providers are facing situations where tensions can escalate quickly. That creates risk for your organizations, your clients, and your staff. We believe many of these conflicts can be avoided with simple conversation management tactics and safety planning. Our training is tailored to your team, including your non-technical operations staff and your real-world environment. Unlike most trainings, the majority of our time together is spent in role play, practicing realistic scenarios. Staff are practicing reading cues, using calm and trauma-informed language, setting safe boundaries, and working as a team under pressure. We bring a lot of experience from residential behavioral health care, clinical settings, and more. We would be thrilled to bring those skills to your team and the real world practice to make that happen. And I'll be in room 7. Thank you.
Thank you so much. We now have Impact Care.
Hello, my name is Janae Tyus. I am head of community mobilization at Impact Care. I am not Dawn Alley. I am her imposter. So I'm here to just bring you greetings from Impact, just sharing you a little bit about who we are. We are approved in domains 4 and 7. We are the most evidence-based and widely used CHW program across the United States. So we work with a vast number of partners across various sectors, and we believe that CHWs are the right workforce to operationalize the management. So in ECM, we work with employers supporting ECM to provide hands-on, evidence-based technical and assistance that includes what you see on this slide. We make it easy and fast to build an effective CHW workforce. And so we are here to do that with all of you who are interested. I'll just uplift a quote from one of our CBO leaders. From their perspective, they said that the thoroughness of the training, systems and tools, implementation assistance, and the encouragement and coordination from our staff have been tremendously helpful in starting a new program. I will be in room 4 to help you guys if you have any questions regarding standing up a CHW program.
Thank you. We now have Indigenous Pact. And Ashley, oh, there you go. Go right ahead.
Maru'oe. Hello, my name is Ashley Hesse, and I am of Comanche descent. I serve as Vice President of Tribal and State Government Affairs for Indigenous Pact, a Native woman-owned public benefit corporation committed to achieving health equity for American Indians and Alaska Natives across Turtle Island. We align closely with the goals of CalAIM and the Enhanced Care Management Program by providing hands-on support to tribal and rural health organizations through strategic healthcare initiatives, from facility planning and feasibility studies to revenue cycle analysis and community health assessments to address social determinants of health. We have a multi-state board-certified physician group to deliver on-demand care tailored to tribal needs, integrating traditional Indigenous knowledge with modern healthcare technologies. We also provide customized advisory services to help Indian healthcare and rural healthcare providers manage technology transitions, refine clinical workflows, improve care management practices, and enhance patient outcomes and financial sustainability. Really, at the heart of our work is a deep commitment to rural health, equity, tribal sovereignty, and culturally grounded care.
Thank you. Up next, we have IRG, Insight Research Group.
Hello, everyone. My name is Richard Mancuso, founder of IRG. You're probably here because you want to serve your community through ECM and community supports, but you often feel like you're pushing a boulder uphill, stuck dealing with MCP contracts, billing rejections, figuring out what technology you actually need, and more. You're operators first, not CalAIM implementation experts. IRG is a small but mighty mission-driven team that left big consulting and big healthcare to create an equitable impact on underserved communities through practical hands-on support. We strive to make it super simple. We want you to feel confident and supported at every step of the way. We helped First 5 Alameda go from 0 to operational in just 90 days, and we've also worked extensively with one of the largest ECM providers. I'd like you to walk away with some tangible value today. A lot of folks are concerned about the impact of HR1 on ECM, community supports, and CalAIM. So as a resource to this community, we've pulled together a white paper we'd like to share. If you grab your phone and scan the QR code on this slide, you'll go to a page we created specifically for this community. Download the white paper, and you'll also see an option to book a complimentary 30-minute office hours where we can brainstorm any challenges that you're facing. Thank you for the work that you do. I look forward to speaking with you soon.
Hey, thank you so much. We now have Maternal Mental Health Now.
Good afternoon. My name is Kelly O'Connor. My pronouns are she, her, and I am the Executive Director of Maternal Mental Health Now. We are a LA-based nonprofit organization, and our mission is to remove barriers to the prevention, identification, and treatment of perinatal mood and anxiety disorders in LA County. We primarily do that through training of healthcare and social service providers and mental health care providers on how to screen, how to treat, how to refer patients or clients that are struggling. So our TA marketplace services are within Domain 7 workforce, and they're specifically focused on the birth justice population of focus. We have a couple of publications and an online training video in the on-demands library. And we also offer customized trainings to healthcare institutions on how to increase their screening rates, how to increase their positive screening rates or to screen accurately, how to better serve their pregnant and postpartum people and their mental health struggles. So I will be in breakout room 7. Thank you.
Thank you. We now have My Baby My Way Foundation.
Hello, everyone. I'm Soraya Israel Adan. I'm the Executive Director for My Baby My Way Foundation, and I'm thrilled to introduce you the most innovative and impact-driven TA vendor on the marketplace. We are a woman and minority-owned powerhouse that doesn't just offer technical assistance. We offer building, revenue-generating, community roots-based programs that actually work. So we specialize in 3 high-impact TA domains. That's enhanced care management. We help providers streamline their care and improve their outcomes and deliver all 7 core services with cultural relevance and precision. We also cover health equity from maternal and child health to rural and transitional rent programs. We help design wraparound systems that meet people where they are, especially for BIPOC and underserved communities. Lastly is workforce development. Through our FAME Institute, we've trained and scaled teams from 1 to 50, over 50 plus CHWs, doulas, health navigators, community supports, ECMs, by helping bring programs, have sustainable programs and substantially increase revenue while delivering care that actually matters. We combine our hands-on support with AI-driven tools like our platform called My Baby My Way AI.
Thank you,
And
Soraya.
okay, thank you.
Sorry, thank you. All right, we now have Pivot First Consulting.
Hi, everyone. I'm Lucy McKenzie, founder of Pivot First Consulting and Management. We're a certified Black and woman-owned practice management consultancy with over 18 years of healthcare and public health experience. We specialize in helping healers and providers start and grow their Medi-Cal programs through hands-on technical assistance in the domains of building data capacity, promoting health equity, and workforce development. Our approach is grounded in lived experience. Our team has served as caregivers for children and adults with complex mental and physical health needs. That personal understanding fuels our empathy, sharpens our insights, and strengthens our resolve. We know the health system not only as professionals, but also as people who've navigated its barriers for those we love. It's why we listen differently, design more thoughtfully, and remain deeply committed to building practices that are not only operationally and financially sound, but also truly work for families, frontline staff, and the communities you serve. If you'd like to connect, I'll be in breakout room 7.
Great, thank you. We now have Population Health Innovation Lab.
Thank you, Jenna. Hi, everyone. I'm very excited to be here with you today. My name is Catherine Stewart, and I am with the Population Health Innovation Lab, which we lovingly call PHIL. At PHIL, we really try to explore and support innovative approaches that advance health, well-being, and equity, with a particular focus in supporting health-focused collaborative partnerships. And, we've played in the cross-sector partnership space in many different ways for the last 10 years. We do both research and practice and see both as important and complementary, and we really do try to use our learnings to inform and adapt our work. We're approved to provide technical assistance in 3 domains: building data capacity, promoting health equity, and supporting cross-sector partnerships. Our team holds extensive expertise across these domains and beyond, and we're committed to working very closely with our clients and partners to really understand their unique needs and design our support services to best meet their needs and achieve the desired impacts. I hope to see you in breakout room 6 to learn more about your needs and how PHIL might be able to support you in this really hard work that you're doing. Thank you.
Thank you. We now have Praxis Healthcare Advisors, Power Stats.
Good afternoon. I'm Dr. Judith Calvo, and I am the CEO and founder of PowerStats LLC. We're a minority woman-based, woman-owned and woman-based consultancy. And our strength really is in the ability to get down to what data really means. Not just looking at the data and going, wow, that's a great bar chart, but actually being able to do cutting edge insights with your data. And we do not all the way from evaluation and analytics to logic model design, using predictive analytics and machine learning. We also do that. I now have on staff a young data engineer just graduated from Stanford with a degree in electrical engineering, and he is the person who is going to be working with us in terms of using cutting edge AI-driven analysis for richer insights. One of the things that's really over my many years of being centered in the Central Valley and in the Bay Area was that a lot of times organizations have data in notes. They have data in case notes, and they don't have massive.
Judith.
Oh, am I done? Okay,
Yes.
well, I'll see you in breakout room number 8. So, okay, thank you.
Thank you. All right, we now have Praxis Healthcare Advisors.
Good afternoon. My name is Eric Gittens. I'm the CEO of Praxis Healthcare Advisors. A little bit about us. So we partner with healthcare organizations to simplify CalAIM and drive meaningful results. At Praxis, we help organizations like yours unlock the potential of CalAIM by turning complex initiatives into actionable results. We partner with providers, health plans, community organizations to design, launch, and grow programs that improve outcomes, advance equity, and deliver lasting impact. A little bit about our services. So we offer services in enhanced care management, where we can help you develop care models for those high-need Medi-Cal members and also help you engage and, more importantly, retain those complex populations. We offer services and community support as well. We'll help you launch and integrate services addressing social drivers of health, and we'll also help you secure sustainable funding as well. When it comes to health equity strategies, we use data to identify and close care gaps, and we also help you develop equitable care models. Now, why Praxis? We have a proven track record of sustainable, high-impact programs. We're hands-on. It's a tailored approach. It's not a one-size-fits-all, and we have deep expertise in CalAIM, policy translation, operational execution, and we're going to help you make a lasting community impact. So if you're inclined, you can reach out to me at info@praxishealthcare.com or come see me in breakout room number 4. Thank you.
Thank you.
You're welcome.
We now have Sandigan Consulting.
Hi, I'm Shailani Alex from Sandigan Consulting. Thank you for the space to present here. At Sandigan, we understand the pressures government agencies, nonprofits, and community organizations face. Might be tight budgets, staffing shortages, complex systems, policy changes, all amidst the urgency to deliver equitable quality services. We're a Bay Area-based firm with 20+ years experience in the healthcare and nonprofit sectors, specializing in data, finance, and operations. And our services range from operational workflow improvement to leading or advising on technical data system transitions that support and maximize organization initiatives and fiscal strategies. Our general approach aims to solve immediate problems while also equipping teams to drive lasting impact long after our engagement with the project is done. So whether you're looking to optimize billing workflows or navigate technical system decisions and implementation, we'll be your partner in the commitment to sustainable community-centered change. So see you in breakout room 8.
Thank you. Up next, we have the Health Justice Partnership at UC Law SF.
Hi, my name is Elizabeth Peters. So I wanted to introduce you all to the Health Justice Partnership at UC Law San Francisco. We are a network of California-based medical legal organizations offering technical assistance training and tools to CS and ECM providers. We're comprised of longstanding California-based nonprofits, and we're located throughout the state in both rural and urban areas, and we have decades of experience addressing the social and legal needs of Californians. So the Health Justice Partnership joined the marketplace to offer technical assistance because Medi-Cal patients experience complex social and legal barriers to care, and legal aid experts can help CalAIM providers address these barriers. Additionally, medical legal partnership and collaboration has been shown to help improve health workforce knowledge, satisfaction, and morale, to help improve patient social care and health outcomes, and to help reduce avoidable utilization of the healthcare system. And so the Health Justice Partnership can provide hands-on technical assistance for 5 domains, which are promoting health equity, workforce, community supports, ECM, and supporting cross-sector partnership. And we can offer interprofessional training, workflow development, consultation, tools, convening support, and more. So you'll find us in breakout room 4.
Thank you. We now have Ubuntu Psychological Services.
Hi, everyone. I'm Dr. Reed. I'm the founder and CEO of Amutu Psychological Services. We're a woman-owned, minority-owned consulting and clinical practice. We specialize in culturally responsive and equity-driven solutions for organizations, particularly those in diverse CalAIM populations. And we're in Domain 5, which is promoting health equity. One of our specialties is in maternal and child health. And as a vendor, we are able to help assist with assessing, design, implementation, and really helping people sustain a project in ECM or community support strategies. Not only just to help them meet the compliance, but to help them close any kind of gaps or transform any kind of systems they have in their care. One of the things that our team does is they have expertise in policy and lived experience. Most importantly, our entire team is licensed psychologists, social workers, and marriage and family therapists. And so this is really going to be helpful for ensuring solutions and practical ability to be able to sustain, particularly help in the maternal and child health arena. So you get a lot with Ubuntu, but one of the things that you really get is people who are trained with a track record in building trust and improving engagement, particularly for those who are in the Medi-Cal families.
Thank you. And apologies for the mispronunciation. Up next, and we have Zuri Mind.
Hi, can you hear me? My name is Hilda. I am the founder of Zuri Mind Psychiatric Nursing Practice. We have years of experience delivering trauma-informed care across the vast health sectors. We have been approved to provide TA services hands-on for domain 1 and 2. And you wonder, why do you want to choose us? See that beach right there? That's why. Our programs are tailored to meet organizations where they are. We design training that adapts to different learning styles and individuals to needs within each team, ensuring that every participant can engage, learn, and grow. By blending evidence-based practices with flexibility, we help your organization achieve the goals that they have set out to do. Please meet me at Brick Room 2 if you have any questions. Thank you.
Thank you. And that actually concludes our vendor pitches. However, I do believe there is one that we missed. Ethiopia, we have from, I believe it was Community. So do want to give you the opportunity to come off mute. And Courtney, if you can move to that breakout slide, we can give you your 60 seconds. And apologies for flipping through, but go ahead and come off mute.
Thank you so much, Jenna. My name is Hamdia Sharif. I am speaking on behalf of Ethiopia. I am the Assistant Director here at Community. Here at Community, we are an equity-focused TA vendor committed to breaking down barriers to health and social care access. Something that helps us stand out is the fact that we have lived experience. We are Black-owned, women-owned, and we operate as doulas first before we moved on to assisting people joining like managed care plans and a focus on overall health equity. We have partnered with health plans, CBOs, and clinics to implement innovative sustainable care models. We have been fortunate enough to deliver trainings to TA and TA technical assistance to organizations serving 5,000 community members annually, and that is across all of California. Our expertise is in system design and integration, policy and compliance navigation, as well as cultural competency care strategies. We really specialize in the BIPOC, immigrant, and rural communities across California. And the reason why you should choose us is because we do have a deep knowledge of the Medi-Cal and health equity initiatives. We are a part of a lot of those conversations, and we have a proven ability to turn funding into functional, impactful programs. And I can see Jenna, you're looking at me, so let me move on to the connect with us. You can reach us at community with a -t.org or at Ethiopia or help desk at oocommunitydoulas.org. And we will be in domain 5 to answer any questions.
Thank you so much. And as we move over to the breakout room overview, I just want to take a moment to thank all of the vendors here today. I know how hard it is to do a pitch with all this great detail on your slide within 60 seconds. So really appreciate you taking the time. So before moving to the breakout rooms, just wanted to go over a few logistics. Again, as a reminder, these are an opportunity for attendees to ask questions of specific vendors and hear more details details about their services, projects, experience, etc. There will be an opportunity for you to come off mute, but we do ask that you raise your hand before asking a question so that a member of the PCG team can call on you and have you ask your question. We ask that you remain muted if you are not talking, just to allow space for folks to answer and avoid background noise. And we are going to send out messages to the breakout rooms at the 5 and 1 minute marks, so that you will be warned when you will be pulled back into the main room for our final slides, Q&A, and closing remarks. And again, a final reminder that if you do not have the Zoom application downloaded, please rejoin with that application so that you will be able to join the breakout rooms. Next slide. Additionally, just a few notes about moving between breakout rooms. Attendees will be automatically and randomly assigned to a breakout room. So once you are in your room, you are able to move between those breakout rooms. When the breakout rooms open, though, we do ask you select join and when that pop-up appears. But to move between the breakout rooms, there is a breakout room button at the bottom of your screen. You can click that and you will see the breakout room listed. Again, we will have a slide that shows which breakout rooms have which vendors. So if you are looking for a particular vendor, you will be able to identify the breakout room you would like to join. Additionally, if you are experiencing any technical issues or need to return to the main room for any reason, there is an option for you to leave the breakout room, and that will bring you back to the main room. And next slide. So here are our breakout room assignments. Again, this slide will appear in each of the individual breakout rooms. I will ask Courtney to open up those breakout rooms. A pop-up will appear for you again. You can click join. For our vendors, it will show you that if you click to breakout rooms, it should allow you to select a breakout room to join. So we do ask that you identify your appropriate breakout room and join that room now. With that, we look forward to these breakout rooms and seeing you over there. Hi, everyone. You are now back in the main room. Our breakout rooms have concluded. A big thank you to everyone. I know we were pressed for time, and I really appreciate the chatter and discussions during those breakout rooms today. So with the time remaining, I just want to walk through a quick few updates, some resources available on the marketplace to hopefully get you started and kicked off with one of the vendors that joined today. So we can go to the next slide. So you will see the TA Marketplace homepage listed here. The homepage gives you a lot of information about how the marketplace is operated, what types of projects can be added, more information about those domains, and then additionally, a step-by-step process about how to apply for the marketplace if you are not yet an approved TA recipient. So you will be required to submit an application, just confirming that you are either providing and contracted for ECM and or community support services, or are working towards a contract with a managed care plan. Next slide. Additionally, I know I highlighted in my breakout room, but when you visit the TA Marketplace, you will see a long list of vendors and projects. To learn more information about a particular vendor, you can utilize the vendor profile card. So once you identify a vendor from our list, click on their profile and you'll see a bit more information about the organization, what domains they are approved under, client testimonials, and then importantly, that contact information so that you can reach out and ask your questions, hopefully engage a bit prior to pursuing an application, and then get started on the marketplace. Next slide. So excuse me. To explore the marketplace, there is at the top of the webpage of the PATH program, you will see Explore the Marketplace. Again, that will bring you to a long list of off-the-shelf projects, hands-on vendors. So this is just an example also to see our off-the-shelf projects and the description that will show for those vendors that have those projects. Next slide. And then importantly, I know there was one person asking particularly for how to identify a vendor that can support them with data. So we do have filters available on the marketplace as well. So on the left-hand side here, and I apologize, I know it's small to see, but you will see a long list of filters that you can select to identify a vendor that is either approved in the correct domain, has experience with particular technical assistance needs, has experience supporting particular provider types, and also including those areas of focus. Additionally, if you have found a vendor here today and are looking to find their profile, if you select Find Vendor at the top of the page, you will find the full list of our vendors, and you'll be able to click which one you would like to visit and then visit that vendor profile. Next slide. So again, TA recipient eligibility, we have 3 pathways to get approved. First is to be contracted with a managed care plan for ECM and or community supports. That requires a signed attestation form by the recipient organization and a contract page that contains the signature from the managed care plan. Additionally, we also have folks apply under planning to contract, recognizing you may be in negotiations or discussions with managed care plans. You can have an attestation form signed by the managed care plan and your organization. And then lastly, we also have this special pathway to be approved by DHCS. So if you are really new but really excited to be providing ECM and community supports, you can complete a survey under the approved by DHCS, and we will review that application survey with DHCS for their consideration. Next slide. Additionally, earlier this summer, we released some new criteria that applies to all TA Marketplace recipients. This is a result of the TA Marketplace growth over the past year and some budgetary concerns. So currently there are 4 criteria that all applications must meet. So first, projects have to be for any new TA recipient, meaning that if you currently have a project at this time, you are not eligible unless applying for a project that will support with transitional rent. Additionally, recipients are limited to 1 project, so we really encourage you to work with your identified vendor to identify what is most needed for your organization to get prepared. Additionally, if you are not yet contracted, we require that you have a contracting goal and deliverable related to the project. And then lastly, we have a limitation for our vendors to not exceed $150,000 and request that the project be completed within 1 year. We do have links to the policy guides, which also appear on the TA Marketplace homepage that do outline this a bit further. Next slide. And again, these slides will be shared following today's call. We have some helpful links here. Again, these are all available on the TA Marketplace website. Should you have any questions or concerns, you can also reach out to the TA Marketplace email. We typically provide responses within about 48 hours. And with that, we of our Q&A. We recognize we only have about 3 minutes, so if we are unable to answer your your question today, we will be including it in the Q&A document that we will send out as part of today's webinar materials. Additionally, of course, you may also ask your question to the chat. For questions, how are we able to exchange contact information? If you are looking for a particular vendor, you can reach out to the TA Marketplace and we'll be sure to get you the vendor that presented today and the person that presented today. Otherwise, we recommend you visit their vendor profile. And again, their contact information should be listed on their vendor profile card. What is the deadline to apply for TA funds? Is it correct that DHCS has announced the TA marketplace will no longer be available after December 2025? So again, as I noted at the, talking through those new limitations, there have been some concerns regarding what funds are remaining and trying to be as equitable as possible with the remaining funds. That being said, the goal is to remain open at least through January of 2026. We will be remaining as communicative as we can be about how long the marketplace will be open thereafter. Our goal is to be open as long as possible, but ultimately definitely open through January of 26 is the real goal. However, that does not mean your projects end then. Projects can be open through December of 26. So if you apply now looking for a year-long project, that project will remain open through September of 2026, applying that 1-year rule. All right. Alrighty. Looking to see if there are any other questions. Again, just reiterating that we will be sharing all of these slides following today's call, and then the recording as well when that becomes available. So one more question. All right. So apply, yes. So you can apply also, just a note that if you want to apply right now for a project to begin in January, you can do so. Especially if you do not believe that you have the bandwidth to start that project until, in the next couple of months. If the project is up to muster, we will approve it. So don't hesitate to start applying if you know there is something that you want support with, to ensure that we can secure that funding for you. All right. Well, we are just at that mark of today's webinar, concluding our webinar. So just thank you again for your time. A big thank you to our 35 vendors that shared all of their unique services available on the marketplace. Again, if you have any questions for the TA Marketplace team, our email is available here. That is the best way to reach us. And we thank you again for your time and participation on today's call, and we look forward to seeing your applications. Thank you, everyone.
Thank you. Have a good day.
Goodbye.
Thank you.
Goodbye.
Bye, everyone.
Thank you.